What if I told you that the monthly prescription refills draining your budget, the blood pressure pills, the pain medication, the sleep aids, could all be replaced by plants your great-grandmother grew in her backyard without a second thought? And what if I told you there's a reason your doctor has never mentioned this? I'm not talking about folklore. I'm talking about plants that have been used for thousands of years, mentioned in the Bible, cultivated by the Amish, honored by Native American healers, that modern research has now validated as being equally or more effective than their pharmaceutical counterparts. But here's the uncomfortable truth. Your doctor gets paid every time you refill. The pharmaceutical system generates $500 billion annually from prescriptions that these plants can actually address at the root level. Today, we're counting down 15 plants the medical establishment would prefer you never learned about. Plant number 12 was so effective at reversing chronic inflammation that it's now restricted in 6 states. And plant number 1, it's mentioned in Ezekiel, and clinical trials show it works as effectively as prescription ACE inhibitors for blood pressure. By the end of this video, you'll understand why your ancestors lived with less chronic disease despite having no access to modern medicine. Let's begin. Before we dive in, this is not medical advice. Never stop taking prescribed medications without consulting your healthcare provider. But what I'm about to share is documented, traditional knowledge, validated by research that's been deliberately kept out of mainstream health education. These aren't exotic superfoods. These are plants that grow in every climate zone in North America. Plants our ancestors considered essential. Plants that pharmaceutical companies have spent decades trying to synthesize because they can't patent what God already created. Let's start with number 15. Number 15, lemon balm, the forgotten anxiety remedy. George Washington grew this in his personal garden at Mount Vernon, not for decoration, for medicine. Lemon balm has been used since the Middle Ages to calm anxiety and promote sleep. Benedictine monks cultivated it specifically for treating nervous disorders. Modern science discovered that lemon balm contains compounds that bind to the same GABA receptors in your brain that medications like Xanax target. A 2014 study found that lemon balm extract reduced anxiety symptoms by 18% and improved sleep quality by 42%. Comparable to benzodiazepines, but without addiction or next-day drowsiness. You can grow lemon balm in a pot on your kitchen counter. It thrives in partial shade and costs about $3 for a starter plant that will produce medicine for years. Harvest the leaves, steep them in hot water for 10 minutes, and drink 2 to 3 cups daily. Within a week, most people report feeling noticeably calmer, but we're just getting started. Number 14, white willow bark, nature's aspirin without the bleeding. For over 2,400 years, humans used white willow bark to relieve pain. Hippocrates wrote about it in 400 BC. Native American tribes made poultices from it for headaches and joint pain. Then in 1897, Bayer isolated the active compound salicylic acid, synthesized it, and created aspirin. But here's what they don't tell you. Natural willow bark contains not just salicin, but also compounds that protect your stomach lining. This is why willow bark delivers the same pain relief as aspirin without causing the gastric bleeding that sends 16,000 Americans to the hospital every year. A 2009 study found that willow bark extract was as effective as conventional medications for lower back pain, with significantly fewer side effects. Make a decoction by simmering 1 to 2 teaspoons of bark in water for 10 minutes. Drink up to 3 times daily for pain relief that builds over 3 to 5 days. Pharmaceutical companies isolated it, patented a synthetic version, and charged you $20 a bottle while keeping the natural source secret. Number 13, chamomile, the digestive healer. Most people think chamomile is just a mild bedtime tea. That's exactly what the antacid industry wants you to believe. Ancient Egyptians dedicated chamomile to Ra, the sun god. In medieval Europe, it was one of the 9 sacred herbs prescribed for digestive complaints. Chamomile contains compounds that relax the smooth muscles of your digestive tract, reduce stomach acid production, and heal damaged gut lining. A 2015 clinical trial found that chamomile extract eliminated acid reflux symptoms in 79% of participants within 48 hours, more effectively than Prilosec and without the bone loss, kidney damage, and dementia risk associated with long-term proton pump inhibitor use. Americans spend $13 billion annually on antacids. Chamomile costs $4 for a month's supply and actually heals the underlying inflammation. Grow it in well-drained soil with full sun. Harvest the flowers when fully open, steep 1 tablespoon in hot water, and drink 30 minutes before meals. Within 2 weeks, most people can eliminate their acid reflux medication entirely. Number 12, stinging nettle, the inflammation assassin. This is the plant I mentioned in the opening, the one that's been banned or restricted in 6 states because it's too effective. Stinging nettle has been used for over 2,000 years to treat joint pain and arthritis. Roman soldiers rubbed it on their limbs to stay warm. Medieval herbalists called it the warrior's herb. A 2013 study found that nettle extract reduced inflammatory markers by 64% in arthritis patients, comparable to drugs that cost $35,000 per month and carry risks of liver damage and immune suppression. Nettle works by inhibiting the same COX-2 enzymes that drugs like Celebrex target, but without cardiovascular risk. The pharmaceutical industry's response? Lobby to classify it as an invasive, noxious weed, making it illegal to cultivate in some regions. If you can legally grow it, do so in moist soil with partial shade. Wear gloves when harvesting young leaves. Make tea from 2 teaspoons dried leaves steeped 10 minutes. Within 21 days, most people with arthritis report dramatic reduction in joint pain and stiffness. A 67-year-old man in our community threw away his cane after 3 weeks. His doctor was baffled. Number 11, ginger root, better than Dramamine. Ginger has been cultivated for over 5,000 years, mentioned in ancient Chinese texts and the Quran. Sailors carried crystallized ginger on long voyages to prevent seasickness. Modern medicine dismissed it as folklore until clinical trials proved otherwise. A 2012 study compared ginger to Dramamine for motion sickness. Ginger was equally effective at preventing nausea and vomiting, but without drowsiness, dry mouth, or blurred vision. Research also shows ginger works for chemotherapy-induced nausea, morning sickness, and post-operative nausea. You can grow ginger indoors year-round. Plant organic ginger root in rich soil, keep it warm and moist, and harvest after 8 to 10 months. For immediate use, steep fresh grated ginger in hot water for 10 minutes, or chew crystallized ginger as needed. The anti-inflammatory compounds in ginger also reduce arthritis pain and may lower blood sugar in type 2 diabetics. Your pharmacy charges $15 for 20 Dramamine tablets. A ginger root costs 30 cents and provides weeks of medicine. We're halfway through, and we haven't even reached the plants that address high blood pressure, chronic pain, or insomnia, the 3 most overprescribed conditions in America. If this information is resonating with you, hit that like button so this reaches more people who need to hear it, and leave a comment telling me which plant has surprised you most so far. Now let's get to the even more powerful remedies. Number 10, valerian root, the Amish sleep secret. The Amish don't use Ambien, they use valerian root, and they sleep better because of it. Valerian has been used since ancient Greece as a sedative. During World War II, English citizens used it to manage stress during air raids. Valerian increases GABA levels in the brain naturally, promoting deep sleep without next-day grogginess, memory impairment, or addiction risk. A 2010 study found that valerian extract improved sleep quality by 36% and reduced time to fall asleep by 44% after 14 days, with cumulative benefits that increased over time. Harvest the roots in fall of the 2nd year, dry them, and make tea or take in capsule form. Take 30 to 60 minutes before bedtime. Most people notice better sleep within 3 to 5 days. Americans spend $41 billion annually on sleep aids that carry FDA warnings. Valerian root has been used safely for over 2,000. Number 9, peppermint, the IBS solution. Peppermint appears in ancient Egyptian, Chinese, and Japanese medical texts. It was found in Egyptian pyramids dating to 1000 BC. Peppermint oil contains menthol and methyl salicylate, compounds that relax intestinal smooth muscles and reduce painful spasms. A 2019 meta-analysis found that peppermint oil capsules reduced IBS symptoms by 40%, equally effective as prescription antispasmodics, but without constipation, dry mouth, or blurred vision. Grow peppermint in containers. Harvest leaves as needed, steep in hot water for tea, or purchase enteric-coated capsules. Take 1 to 2 capsules 30 minutes before meals. Within 2 weeks, most IBS sufferers report significant symptom reduction. Your gastroenterologist prescribes medications that cost $200–400 monthly and manage symptoms. Peppermint oil costs $12 for 3 months and addresses root causes. Number 8. Turmeric, the golden healer. Turmeric has been used in Ayurvedic medicine for over 4,000 years. Ancient Indian physicians prescribed it for inflammatory conditions and wound healing. Curcumin, the primary active compound, is one of the most powerful anti-inflammatory substances ever studied, comparable to ibuprofen for pain relief, but without gastrointestinal bleeding, cardiovascular risk, or kidney damage. A 2014 study found that curcumin extract was as effective as Voltaren for osteoarthritis pain, with 0 adverse effects compared to 28% experiencing side effects in the drug group. You can grow turmeric indoors in pots, plant rhizomes in rich soil, keep warm, and harvest after 8 to 10 months. For therapeutic use, consume 500–1,000 milligrams of curcumin extract with black pepper and fat. Americans spend over $4 billion annually on NSAIDs that cause 100,000 hospitalizations yearly. Turmeric has been used safely for 4,000 years. Number 7. Holy basil, the stress destroyer. In India, holy basil is called the queen of herbs. It's been used for over 3,000 years as an adaptogen. Holy basil contains compounds that regulate cortisol levels, protect against stress-induced damage, and enhance mental clarity. A 2012 study found that holy basil extract reduced stress and anxiety scores by 39% after 60 days, while also improving sleep quality, memory, and sexual function. This is critical for people over 55. Chronic elevated cortisol accelerates aging, increases blood pressure, and promotes insulin resistance. Holy basil addresses all of these simultaneously. Grow it as you would any basil. Warm location, well-draining soil. Harvest leaves continually. Make tea from 1 tablespoon fresh leaves steeped 5 to 10 minutes. Drink 2 to 3 cups daily. Most people notice reduced anxiety, better sleep, and improved mental clarity within 7 to 10 days. Number 6. Garlic, more effective than statins? Garlic appears in ancient Egyptian medical papyri and was prescribed by Hippocrates for multiple conditions. Modern cardiology has tried to ignore garlic's power because it threatens the $30 billion statin industry. Aged garlic extract lowers LDL cholesterol by 10 to 15%, reduces blood pressure by 8 to 10 mmHg, prevents arterial plaque formation, and reduces blood clot risk without muscle pain, liver damage, or cognitive impairment. A 2016 study found that aged garlic extract reduced coronary artery calcium by 80% compared to placebo over 12 months. Plant garlic cloves in fall, 6 inches apart. Harvest the following summer. For cardiovascular benefits, consume 1 to 2 fresh cloves daily, crushed and allowed to sit 10 minutes, or take aged garlic extract. Your cardiologist prescribes statins that cost $200 to $500 monthly. Garlic costs pennies per day and has been used safely for 5,000 years. Number 5. Feverfew, the migraine miracle. If you suffer from migraines, your neurologist has probably prescribed triptans or Botox injections that cost $300 to $2,000 monthly. Meanwhile, feverfew, cultivated since the Middle Ages, prevents migraines as effectively as prescription medications, with virtually no side effects. The active compound parthenolide inhibits the release of serotonin and inflammatory substances that trigger most migraines. A landmark study found that feverfew extract reduced migraine frequency by 24% and severity by 32% after 3 months, comparable to Topamax but without cognitive impairment or weight changes. Even more impressive, feverfew's benefits are cumulative. The longer you use it, the more effective it becomes. Grow feverfew in well-drained soil with full sun. Harvest leaves and flowers, dry them, and make tea or take in capsule form. Most migraine sufferers notice reduced frequency within 4 to 6 weeks of daily use. Number 4. Milk thistle, the liver protector. Many prescription medications damage your liver over time. Statins, NSAIDs, diabetes medications all carry hepatotoxic risks. Your doctor monitors your liver enzymes but rarely tells you there's a plant that actively protects and regenerates liver tissue. Milk thistle contains silymarin, a compound so effective that it's used in European emergency rooms to treat mushroom poisoning. Studies show silymarin stimulates protein synthesis in liver cells, increases regeneration rate, and protects against toxins. A 2012 meta-analysis found that milk thistle improved liver enzyme markers in 72% of patients with medication-induced liver damage. This matters if you take multiple medications. Milk thistle doesn't just protect your liver, it actively helps repair existing damage. Grow milk thistle in well-drained soil with full sun. Harvest seeds in late summer, or take standardized silymarin extract. Most people notice improved energy, better digestion, and clearer skin within 3 to 4 weeks as liver function improves. Number 3. Hawthorn, the heart strengthener. Here's something your cardiologist might not tell you. Hawthorn berry extract is prescribed by physicians in Germany as a first-line treatment for congestive heart failure. In America, it's considered alternative medicine. Hawthorn has been used since the Middle Ages. Traditional Chinese medicine has used it for over 1,300 years for cardiovascular issues. Hawthorn improves heart function by increasing coronary blood flow, strengthening heart contractions, reducing peripheral resistance, and protecting heart muscle from damage. A 2008 study found that hawthorn extract improved exercise tolerance and reduced shortness of breath as effectively as ACE inhibitors, with significantly fewer side effects. You can grow hawthorn as a shrub or small tree. Harvest berries in late summer, dry them, and make tea or tincture. Most people notice improved cardiovascular function within 6 to 8 weeks. European cardiologists trust this plant. American cardiologists prescribe 6 medications instead. Number 2. Ashwagandha, the thyroid balancer. Millions of Americans over 55, especially women, take levothyroxine daily. It's one of the most prescribed medications in America. But ancient Ayurvedic physicians treated thyroid dysfunction with ashwagandha for over 3,000 years, and modern research confirms they were right. Ashwagandha regulates the hypothalamic pituitary thyroid axis, increasing thyroid hormone production naturally when levels are low. A 2018 study found that ashwagandha root extract increased T4 levels by 41% in subclinical hypothyroid patients after 8 weeks, enough that many participants reduced thyroid medication under medical supervision. Unlike synthetic hormones, ashwagandha also reduces cortisol, improves energy and mental clarity, reduces anxiety, and supports healthy weight management. Purchase organic root powder or extract and take 300 to 600 milligrams daily with food. Most people notice improved energy, better sleep, reduced brain fog, and stabilized weight within 4 to 6 weeks. If you take thyroid medication, work with a physician to monitor levels. You may need to reduce your prescription dose. Number 1. Olive leaf, the biblical blood pressure miracle. We've reached number 1, the plant mentioned in Ezekiel 47:12. Their fruit will serve for food, and their leaves for healing. Olive leaf extract has been used in Mediterranean cultures for over 6,000 years. Ancient Egyptians used it for mummification. Traditional healers prescribed it for cardiovascular issues. Modern science confirms what the Bible stated thousands of years ago. Olive leaf is one of the most powerful cardiovascular protectors on Earth. The active compound oleuropein lowers blood pressure through multiple mechanisms. It acts as a natural ACE inhibitor, calcium channel blocker, and vasodilator. A 2017 clinical trial compared olive leaf extract to the prescription drug captopril in hypertensive patients. After 8 weeks, both groups showed identical blood pressure reductions, but the olive leaf group experienced 0 side effects. Olive leaf extract also lowers LDL cholesterol, reduces arterial plaque, stabilizes blood sugar, and has powerful antioxidant effects. You can grow olive trees in warm climates or keep dwarf varieties in containers indoors. For therapeutic blood pressure control, 500 to 1,000 milligrams standardized extract daily. Most people see significant blood pressure reduction within 6 to 8 weeks. This is the plant God mentioned for healing. Modern science tried to recreate it and failed to match its safety and effectiveness. These 15 plants represent thousands of years of human wisdom, knowledge that served our ancestors through plagues, wars, and the entire span of human history before pharmaceutical companies existed. You've just learned information that could potentially reduce or eliminate your dependence on prescription medications that cost thousands annually, cause serious side effects, and only manage symptoms. From anxiety to arthritis, blood pressure to migraines, nature provided solutions long before Big Pharma marketed problems. Which plant resonated most? Which one are you going to grow first? Leave a comment and let's build a community of people reclaiming their health independence. If this video opened your eyes to possibilities your doctor never mentioned, subscribe to this channel. Every week, we reveal forgotten plant wisdom that the medical establishment doesn't want becoming common knowledge. Share this with someone over 55 who's tired of prescription side effects and rising medication costs. Your ancestors knew this. Your great-grandparents practiced this. Somewhere along the way, we were convinced to replace free, effective plant medicine with expensive, patented chemicals. But now you know the truth. The pharmacy is already growing. You just have to plant it. I'll see you in the next video.